Hello, and welcome to Aesculapius. In this video, we'll be covering Fryette's Type 1 and Type 2 segmental dysfunctions. Before we get started, I'd like to outline what we'll be covering. We need to cover some fundamental information before we get into Fryette's laws, so that it will come together more easily at the end. We'll start with the basic anatomy and landmarks used to motion test. Then we'll move on to segmental motion testing. This will include definitions and how to motion test rotational, side bending, and flexion or extension motions. Then we'll cover naming spinal movements, synthesizing the information that we covered before. Then we'll cover Fryette's laws and Type 1 and 2 dysfunctions. We'll end with a couple example questions to give you an idea as to how questions on this material can be written. This slide will cover the basic anatomy commonly used for motion testing. We'll look at a posterior and anterior view of the lumbar spine. For this video, we're going to use L1 and L2 vertebrae as the examples. The body of L1 is here, the spinous process of L1 is here, and the transverse processes of L1 are here. Note that the transverse processes of L1 are superior to the spinous process of L1. This will be important for when you're trying to find the transverse processes to motion test. When testing the motion of vertebral segments is done using a 2-vertebral unit, and as mentioned earlier, we're going to use L1 on L2, which is here. Before we get into motion testing, a lot of these definitions involve descriptions using planes of motion. It'll be helpful to review your basic anatomy for the transverse, coronal, and sagittal planes. Basic segmental motion testing of rotation. Remember, we're referring to a 2-vertebral unit, L1 on L2, so rotation. What is the definition? A segment can be rotated right, left, or not at all, and all this occurs as movement of the segment in a transverse plane about a vertical axis. What does this mean? What's an easier way to think about this? I like to imagine the segment as a bicycle with the transverse processes, the handlebars, and the body of the vertebra as the tire. If you are going to rotate the segment to the right, it's the same as turning the bicycle to the right. You're going to pull the right handlebar towards you, the right transverse process, and push the left one away from you. Here's an example of what this would look like in a spine. This is our 2-vertebral unit, L1 on L2. Remember, the transverse processes are the handlebars and the body is the tire. If a segment is rotated to the right, it's going to look like the bike is turning to the right. So if we look at it from above like this, and we rotate the segment to the right, it'll look just like this. And if you can imagine this as a bike, it would be turning off the road to the right. And as you can see, the right transverse process is more posterior, the left is more anterior. If we go back to neutral, and we turn the bike to the left, it'll look like this. As you can see, the left transverse process is more posterior, right is more anterior. Back to neutral. Now that we know what rotation to the left and right should look like, how do we motion test for this? How do we discover which way a segment is rotated in a patient? There are several ways to do this. First, place your thumbs on the transverse processes. Find these by palpating the spinous process of the segment that you're trying to diagnose and moving your thumb superiorly an appropriate distance until you can feel the firmness of the processes. It's difficult to describe how to know when you found the processes, but when you push your thumbs into the patient's back, you'll feel the soft tissues give way until you end with a firm, hard surface that won't move. These are the processes. The first few times you do this, it'll be tricky to know where you are and what you're feeling. So having an instructor or a classmate who successfully found the processes help you find them will be very beneficial. So once you've found the processes, exert equal pressure anteriorly through each thumb into the transverse process. While you're doing this, observe for which thumbnail blanches, turns white first, and is more posterior, closer to you. Whichever thumb blanches and is more posterior is the side the segment is rotated towards. Let's say a segment is rotated right. Which thumb will blanch first and be more posterior? The right thumb, because the right transverse process will be closer to you, more posterior. Remember, when you turn a bicycle to the right handlebar is closer to you, so when you push your thumbs through the soft tissue, your right thumb is going to run into the process first, as the left thumb will have to travel further before it hits its process. Another way to motion test rotation is to exert equal pressure anteriorly, but alternate the pressure. This will be like turning the handlebars back and forth between left and right. What you're looking for here is which way does the segment like to rotate. If your thumb goes deeper into the patient's back than your right thumb, which is stuck more posterior, each time you switch pressures, then the segment likes to rotate right, because it is resisting rotating left. It would be like if the handlebars were rusty and you had a hard time turning the bike to the left. You can turn it to the right easily, but it gets stuck when you try to turn it to the left. Whichever thumb feels more posterior blanches first as the side of the segment is rotated to, and the segment is named for where it likes to go. If it's easier to rotate or turn the bike to the right, it is rotated right. If it likes to go left, it's rotated left. This is what it would look like from your point of view. First, you find the spinous process, here. Then palpate up until you feel the firmness of the transverse processes, here. Push anteriorly with equal pressure and look for which thumb blanches first. The left thumb in this case, indicating that the segment is rotated left. Side bending. Remember, we're talking about our 2 vertebral unit. A segment can be side bent right, left, or not at all, and this occurs as movement in a coronal plane about an anterior-posterior axis. What does this mean? Stand up straight, and without bending forwards or backwards, reach towards one of your ankles. This causes your spine to make a C shape, like a bow, for bow and arrow, and it's this motion without any anterior or posterior component that we're talking about. Here's an example of what it would look like in an individual segment. If it is side bent to the left, the segment would move in a motion like this. Vertebra above this segment would deviate off to the left, and vertebra below it would also deviate to the left, resulting in a bow or C shape to the left. Side bending to the right would look like this. This would push segments above to the right and below to the right, resulting in side bending to the right. Now that we know what side bending looks like, how do you motion test for side bending? There are multiple ways to do this. One of the ways is to place your thumbs on either side of the spinous process, here, and place equal alternating pressure laterally through the process to each side through your thumbs. Imagine you're trying to push the whole vertebra laterally to the left and right, not moving it anterior or posterior at all. This will force the spine to side bend and make this shape, kind of like a parenthesis. If you use your right thumb to push the vertebra to the left, you will force the spine into a literal shape like that. Vice versa is also true. If you use your left thumb to push the vertebra to the right, you will make the shape in the other way. So, if we're going to test side bending to the right, place your thumbs on the spinous process, here, and push with your right thumb laterally to the right, in this motion. By pushing with your right thumb, you'll force the spine to take this shape, which is side bent right. Now, how do you name side bending? Side bending is named for the concavity that is produced. The figure above is concave to the right because it forms a cave with the opening to the right. You create concavity to the right when you push with your right thumb and vice versa. It is named for which side the spine likes to side bend. So, if when motion testing it is more difficult to move the spine with your left thumb, the spine is resisting side bending to the left and is therefore side bent right. For side bending, find the spinous process, place your thumbs on either side, exert pressure to the left and right, and feel for which way the spinal segment likes to move. In this case, it likes to go to the left, therefore it is side bent right. Flexion and extension. Flexion is the anterior movement in a sagittal plane about a transverse axis, and extension is posterior movement in a sagittal plane about a transverse axis. What does this mean? An easy way to conceptualize this is flexion is bending forward at the waist and extension is bending backwards at the waist. Motion testing. This is not necessarily a standalone motion that you test like rotation and side bending. It's tested in conjunction with the other two. Test rotational motion of the segment as discussed previously, but after finding which way it likes to rotate, leave your thumbs on the transverse process and have the patient either flex the spine, bend forward, or extend the spine, bend backwards, while still palpating the transverse processes. If the segment has a flexion or extension component, the rotational component will get better with one motion and worse with the other. Example: say you found L1 on L2 to be rotated right. Your right thumb will be posterior and your left thumb will be anterior. If the segment is flexed, your thumbs will even out. Your right thumb will go more anterior and your left will come posterior when the patient flexes the spine or bends forward. When the patient extends the spine, bends backwards, your thumbs will become more asymmetrical. It is flexed because the segment is less restricted in flexion. Your thumbs become more symmetrical because it isn't held in right rotation as strongly and is therefore more free. Of note, there does not have to be a flexion or extension component to a segmental diagnosis. If this is the case, the segment is considered neutral. For the flexion extension component, motion tests for rotational motion. In this case, the left thumb is more posterior, so the patient is rotated left. Then have the patient flex the spine and test the rotational component. In this case, the movement is more free in flexion. Have the patient extend the spine and motion test again. In this case, the rotational component is more exaggerated in extension. After you finish this video, come back to this part and see if you can write the name for this segment's motion and figure out whether it's a type 1 or type 2 dysfunction. This is a summary slide that just summarizes everything for a quick reference. Segmental naming, basics. Naming of a segment contains information about rotation, side bending, and flexion/extension motion. Named for freedom of motion, where does it like to go? A segment that is flexed, rotated right, and side bent right means that the spine moves more freely in flexion, prefers to rotate right, and prefers to side bend right. This means that you'd feel resistance when trying to rotate and side bend the segment to the left, which would be worse in extension. We have several abbreviations that we use: N for neutral, F for flexed, E for extended, S for side bent, R for rotated or right, and L for left. How would you name segment L1 on L2 that's flexed, rotated right, and side bent right? You always name the segment first, L1, followed by the flexion or extension component, followed by rotation, followed by side bending. This would give you L1, flexed, rotated right, side bent right. However, to save space and time, it would likely be named L1, flexed, rotated, side bent right. This is because it's redundant to put the second right in there, as they're both the same side. This will be explained in a little more detail once we get to the Fryette's principles. What about T11 on T12 that's rotated left, side bent right, but doesn't change with flexion or extension? In other words, is neutral. Try and jot the answer down real fast. Pause the video if you like. You could name it T11 NRLSR, neutral, rotated left, side bent right. The neutral means that the rotational component doesn't change in flexion or extension. It could also be named T11RLSR, rotated left, side bent right. As you'll see in the next slide, if the segment is neutral, rotation and side bending will always be in opposite directions. Fryette's principles. Law 1. In the neutral range, side bending and rotation are coupled in opposite directions. What does this mean? Segments' rotational/side bending components will not change with flexion or extension. They're neutral. Second law. In sufficient flexion or extension, side bending and rotation are coupled in the same direction. What does this mean? Segments' rotational, side bending components will be more exaggerated in either flexion or extension. Third law. Initiating movement of a vertebral segment at any plane of motion will modify the movement of that segment in other planes of motion. What does this mean? If you side bend a segment, it's going to have a harder time rotating, and other things are true. If you rotate a segment, it's going to have a harder time side bending as much. Of note, laws 1 and 2 only apply to thoracic and lumbar vertebrae. The cervical vertebrae are unique. So let's talk about the cervical vertebrae. The characteristics. They're said to have Fryette-like movement. This is because flexion and extension have no influence on the rotational or side bending characteristics, but they do follow a pattern. There are also anatomically unique cervical vertebrae, like C1 and C2. Occiput on C1 is always type 1-like. Rotation and side bending occur in opposite directions regardless of the flexion or extension component. C1 on C2 considered to only have a rotational component, as this is where dysfunctions are most commonly found. C2 to C6 considered to always be type 2-like. Rotation and side bending occur in the same direction. C7, this one's anatomically close enough to the thoracic vertebra that it follows the classic Fryette's laws and is influenced by flexion and extension. Fryette's type 1. In the neutral range, side bending and rotation are coupled in opposite directions. What does this mean? As we talked about earlier, segments' rotational side bending components will not change with flexion or extension. They're considered neutral. This often applies to groups of vertebrae. It's called a group curve. So if you diagnose one segment with opposite rotational/side bending components, the vertebra above and below are likely to share the diagnosis. This is not a hard rule, and you can find isolated type 1 segments. Example: T1 to 7, rotated right, side bent left. T1 to 7, due to the tendency to be a group curve, neutral is not included because if rotation and side bending are opposite, it has to be neutral. Remember, first law, side bending and rotation occur in opposite directions. Quick note, when motion testing, if you notice that there is a flexion or extension component, you can immediately rule out type 1 dysfunction and should consider type 2. Motion test for rotation, then proceed to flexion and extension. If there is change with flexion and extension, you can assume it is a type 2, and side bending will be to the same side as the rotation. Fryette's type 2. In sufficient flexion or extension, side bending and rotation are coupled in the same direction. What does this mean? Segments, rotational or side bending components will become more exaggerated in either flexion or extension. This often applies to single segments. These can be found in isolation or at the ends of type 1 group curves. Type 1 curves can be the result of spine compensating for a type 2 segment. Rarely will there be more than 2 type 2 segments next to each other. Example: L4 extended rotated side bent left. Usually isolated, so only one vertebra listed, and only one letter indicating motion, left, as writing it twice would be redundant due to the second law. If there is a flexion or extension component, rotation and side bending will be to the same side. Here are some example questions. We'll start with the first order question. These questions will vary greatly depending on who is writing the question. This is just to give you an idea as to how this information can be tested. Which answer accurately describes rotational motion of a spinal segment? I'll give you a second. Pause the video if you like. B is the correct answer. Remember, rotational movement is similar to turning a bicycle. The next question is a board-style question. A 23-year-old medical student presents with low back pain after studying with poor posture for 8 hours. Palpation of his spine reveals tissue texture changes around vertebra T12 to L4. When palpating the spinal segment L1 on L2, you notice that your right thumb is more posterior than the left, and this asymmetry is exaggerated when the patient bends forward. What is the correct diagnosis? This one has distractors, but remember what's important. I'll give you a second. Pause the video if you like. C is the correct answer. It describes right rotation that gets worse in flexion. This means the segment is extended and type 2. Here are references, and thank you for watching with Aesculapius.